Hello, welcome to our August edition of the Mental Health and Wellness series. This is Realize Africa platform, and we're so happy and excited to be here talking very important and vital issues that help us to be better people in life. In the studio today, I have Dr. Tai Slyne. She's the founder and the director of Amadeus Health Services and Psychiatric Practice in Londonderry, New Hampshire. Dr. Tai Slyne, you're welcome.
Thank you, Oluwatoyin. Thank you.
Awesome. So, good morning, good afternoon, good evening from wherever you're joining us from today. We are so excited to have this maiden edition of the Mental Health and Wellness series kickoff. Like I said earlier, my name is Oluwatoyin, and we are here to discuss this issue that has been stigmatized, or misunderstood, miscommunicated to the people, especially we people of color. And we really hope today that we can paint clearer picture that you can relate with, and also take lessons that will help us move forward as better people. So, Dr. Tai Slyne, when we say mental health, what is this all about?
That's a very good question. Mental health includes our emotional, psychological, and social well being. That's what makes a human being emotional, logical well being. When we have a stable mental health, it means that we can think, we can feel, and we can act well. It determines on how we handle stress of everyday life and how we relate to one another, how we relate to others, and how we make healthy choices. That's what mental health, that's the definition of mental health.
Awesome. Thank you very much. So, to reiterate those things you just said, it is a combination of different factors in our human life: emotional, physical, social interactions, and how we present as human beings, right?
Right.
Awesome. So, I remember growing up in Nigeria, and we hear jokes like, Omagbe Losi Yaba left. Yaba left is a psychiatric hospital in Nigeria, right? And they just believe for you to go to that kind of institution or place, you are not fit to be human in the society. So, how do we demystify understanding mental health as an individual and those debunking the myth around it? Do you have to be unfit for the society to be needing mental health? What do you say?
So that's interesting because mental health illness is no different from having diabetes. It's no
Mm,
different from having heart problems like hypertension, hyperlipidemia, which is high cholesterol level. And if
okay.
you have any of those issues, and even cancer, we all seek treatment. Does
Sure.
that make anybody less of a person? No. Mental
Mm,
illness is a disease of the brain. And of course, we can't see the brain. We can only see the brain when someone is died and we do an autopsy and we look at the brain. But mental illness means that there are changes in the emotions, in the thinking and behavior of a person. And so it is highly treatable. Just as we would treat diabetes, just as we would treat heart condition, it is highly treatable. And so therefore we need to destigmatize people with mental health. And 1 in every 3 to 5 people have a form of mental illness. If we were to take everybody that has mental illness to a psychiatric hospital, we will have no population. We will have no generation of people. So it is highly treatable. It's just that there are various forms of mental illness, and we can get into that. But we need to destigmatize mental illness. We also have to destigmatize people that associate with them, that, oh, now you're all on the same bus. No, we have to look at it as of the brain and of the mind, and it can be treated, and somebody can have a full functioning life.
Thank you so much, Dr. Tai. Um, the next question is, in our day-to-day life, where does mental health evaluation or need for attention to mental health, when does it come in? Is there a certain age
Well, mental
brackets you attain that then you become worrisome of your?
mental health can be evaluated at any age group. In usually around the early teenagers and 20s. So when you begin to see a change in behavior, the way people think, the way they act, then sometimes it could be just part of a teenage years where people are trying to determine who they are, and what their life is going to be. It doesn't really mean that they have mental illness. But when there is a change in attitude and behavior, and the thinking process is a little different from everybody else, causing stress or negative attitudes, then one has to do an evaluation, checking in to see what else is going on.
No, you were not done. Go ahead. Hello, Dr. Tai, can you hear me?
No.
Can you hear me now?
Yes.
Some network issues. Just give me a minute. How about now? Can you hear me?
Yes.
Awesome.
We-
So I said I apologize. I thought you were done talking earlier. I think you had one or two more things to say, right?
No, I actually try to talk about how to recognize any form of mental illness and that it is highly treatable. And I can
Okay.
get into the self inventory and trying to figure things out. But I'm done with that question.
Okay. So when we talk of mental health, is this a just one thing or it manifests in different ways, say types of mental health?
There are different types of mental illness, and there are different
Okay.
causes of mental illness. For
Causes,
example,
yeah.
when we talk about depression, for example, that could be a genetic problem in the family, and that's why we take a good family history. First of all, we ask the person, how long have you been depressed? What does depression look like for you? And the person might start saying, I'm sad, or I binge eat, I eat a whole lot, I've gained 20 pounds in a month, or I stopped eating. In cases of someone in West Africa, they typically don't eat when they are depressed, whereas in the
Mm,
United States, because of the abundance of food, people kill their depression by eating a lot here. So
mm,
there's a lot of weight issues here, whereas in West Africa, people don't eat. They feel sad. They have no joy.
mm.
They have no energy. They're exhausted. They're tired. They cry a lot. They, at the drop of anything, they cry. So those are signs of depression. But the question is, does it run in the family? So we take a family history. What's your mom? Is there any depression with your or grandmother or grandfather? We look at the maternal side. We look at the, and then we let them know that depression or sadness is part of life. It doesn't mean that you're a bad person. It could just be chemical imbalance in the brain. And so we tend to treat that chemical imbalance. And once we treat it with various medication or with counseling, the person is okay. And it doesn't mean they're going to be depressed for the rest of their life. It just could be circumstantial form of depression. The other form of mental illness, there is biological factors that could lead to what is called bipolar depression or manic depression. And that could just be the chemicals that was ingested, or viruses, or when the mother was pregnant, she had a terrible virus infection, and it could deplete the chemicals in the brain, causing a form of mental illness. So it is really finding out what the causes and treating it. There's trauma. Trauma could cause postpartum, post-stress PTSD, post-traumatic stress disorder. There's neglect, there's abuse, all form of abuse, whether it's excessive physical abuse. Keep in mind, I use the word excessive because there's nothing wrong with the swatting somebody's butt a little bit and say, no, I need to correct this behavior. But when it's excessive and you beat somebody up in terms of a punishment, that could actually cause a form of mental illness.
If I can,
You
thank you very much. If I can interrupt you. So going back to depression, where you talk about it can be corrected through counseling and medication. How do you think, as a people of color, we can approach counseling in a way that is welcoming and not something to be terrified about?
well, when somebody finds themselves crying all the time, feeling sad, no joy, or even difficulty getting out of bed, the idea of even going one-on-one, say for example, I'm a counselor and someone, I bump into them and they tell me they've been crying, I might say, come meet with me privately. It means that you're open to someone talking with you, telling you that you're going to be okay, telling the person and confiding. And you have to find someone that you can confide in, and someone that will be respectful, that will not share that information with others. That is what makes people feel confident in going for counseling: the privacy, the confidentiality, and opening up to that person. This is what's going on in my life. And that person can begin to give you some ideas. Counseling is just a big word, it's no more than talk therapy to help somebody feel better.
Hmm. Talk therapy, I hear you. At the same time, I believe for this to happen, there has to be a point where that person realizes there is a need to seek external help, right? And be willing to talk.
Absolutely.
Because I
Absolutely.
think as Africans, what I know of us is we're typically resilient and we just want to push everything off. Like, it's going to be all right. And not to talk down on religion and faith. I think another issue I see for people is the place of, oh, my God is good, it will heal me, I'm fine. Do you think there is a need to take actual intentional steps to help our faith? Or what would you say? Because a lot of people in Africa, we go to church a lot and they just believe some of these things will be taken care of. As a practitioner in this field, what can you say to help change the path of people of our color that have tend to see this kind of health care as something that is not necessary, that can be wished away or prayed away?
So there's few parts to that question, and it's a very good question. I think that is there's strength in faith. I think there's strength in going to church. There's strength in
Amen.
spirituality and in God. And those are actually probably will help somebody not develop the complication of depression. There's a place for that. There's also a place for medical intervention. And that medical intervention could be the fact that you need to go speak to a counselor or you need to be on a medication. And it may not be forever and ever, but enough to get you out of the rut. And then you have the
Mm,
spiritual. Remember, we talked about mental health. Mental health is not just, it's social, it's spiritual, it's psychological. So if you address the spiritual with God, that's great. But the chemical imbalance will still be there. So today you're happy, today you're sad. You will have that roller coaster up and down, up and down, up and down. But if you address the spiritual, if you address the medical, if you address the psychological, the mental, the physical, you have a well rounded person. So there's a place and a need for everything. It's like a puzzle. Did we do the spiritual healing? Yes, by going to church. Did we do the mental healing? By seeing a counselor? Did we do the mental healing by seeing a psychiatrist? So you have to dot all the I's, so to speak, to
to
have
cross
a
your T's.
whole person.
Awesome, awesome. So you also touched on family living or family life, how it can also create a long-term impact in a person's overall mental health.
Yes.
How do you suggest as grown-ups to bring conscious actions that will help limit some of these things that can present in the life of people that we raise as children or that are in our network as maybe brother, sister, friends? How do you how can we use this medium to talk to people, to be mindful of the impact of what they do or say to people?
So we know that our words are powerful, right? Our
Mm-hmm.
words are very powerful. Our words, it can make or break things. It could build a person up, it could tear them down. So I think being mindful right from having children, when if they make a mistake, you can still correct and you can function from a place of love by correcting them. But when you destroy a child by the words of the mouth, the spirit, you leave some of like a scar, like a wound in their spirit. If you call, for example, if someone calls their child that they're stupid, for example, you don't do anything wrong, you will never be anything better. That goes right deep into the emotional and mental well being and it stays there. Now, if an outsider says the same thing, a child is easy to say, that's not me, you don't know me, you don't care about me, you don't love me, so it's not going to stay. But if a mother or father or sibling that knows you well, that's supposed to have your back and protect you and love on you and believe in you, say those words, those are very destructive to somebody's mental well-being. So being the tongue, the power of the words can build people up and bring out the best in them and talents in them. And negative words too can actually cause a level of destruction. We may just not see it with our eyes, but emotionally a child might grow up and the patients I see in my office will say, I am like this because my father said this to me, my mom said this to me, they
Hmm.
didn't believe in me, and so there's no need for me to become anything better. Although, in saying that, Africans are very resilient, but it does still impact them. We pass it from generation to generation to generation, and somebody has to break the cycle that the words of our mouth are actually very powerful in our mental well being.
Awesome. Thank you. This is a very good info. Yeah, I don't know if you're seeing me. I'm taking notes. This is very educative for me. Thank you. So, this is good. So perhaps as a child or growing up teenager, people get talked down at and their egos are bruised and they don't really have that courage to leave or to wake up every day to something new and challenging. And we have come in contact with someone like you with this great repository of knowledge. How can we change the course of our functionality as people from the mental wellness space? What can we do? What are the initial steps that we can take to like becoming whole again?
Well, one of the initial steps is supporting one another. It's also recognizing if somebody's behavior and attitude doesn't match. It's also calling the person and say, let me talk with you. There's a place definitely for just recognizing that this child is acting funny, as locked himself or herself up in the bedroom for days. The schoolwork is not being done. They don't eat well. They're up all night, or they're sneaking out of the house, and just calling them and talking to them, hearing
Mm,
their perspective. What's going on? That's usually the start question. What's going on? Tell me about it. And not using it as a weapon in the future to say, you did this. No, it's really hearing them out, because you can change people's life by talking.
mm,
Also, when you recognize that early, try to see if you can get them the right help. Those are the things you can do when you recognize that they're not acting right. Instead of calling them names, is to say, can I get you some help? Do you want to talk to somebody that can get you some help?
thank you. Okay, so I have another question that is coming from a previous conversation I had with a friend. This is in a world of today where money seems to be the driver for most people and motivation for people's actions. Some people that are into um, charity work, developmental work, like myself and Mr. Iriti, the founder of this platform, there's a place where you want to lose your passion for what you love because it's not directly giving financial gratification and people talk down at you. How can you, from this place of psychiatry counseling and guidance, how can you advise such people if they're beginning to lose zeal for what they love to do? It gives them joy, but because people around them are measuring them as not important or significant because what they're doing is not giving them financial empowerment.
Well, I think you one have the Africans I know are so resilient, and you have to, so to speak, keep your eyes on the prize. But we also living in a place either somewhat in recession or somewhat inflation and all of that. So when you decide what you love, keep in mind that you are not going to go to someone and talk about the difficulties or the challenges you have on this job that's not going to support you, because all naysayers. And you go to them and you talk to them about, it's not producing you enough money, but is it emotionally fulfilling for you? Whatever you decide to do, if you're going to be a janitor, be the best. Find your joy in what you do, because not every one of us is going to be doctors. And if it's in construction, if you're a builder, build the best home. But don't go to someone that's not going to support you, because that's going to demoralize you. I don't believe it's going to cause you mental illness, but it might discourage you. We're also living in times are so different. And
Mhm.
so there's a lot more depression, especially now in the United States, because of where we're at. And I would think it's affecting the whole world, especially after COVID. So one has to really keep the eyes on the prize, be in a support society, supportive groups. If you are going to church and you have group of friends that encourage one another, get together once a month, get together once on a Sunday, talk about where are you, and believe in each other. In we're choosing friends that support us. And it's not a bad thing to have a mentor. It's not a bad thing. You don't have to have problems to go to a counselor. That counselor can
Mm.
be just enriching you Oluwatoyin, what's the next step for you? Oh, I'm finishing school. Where are you at? What are you doing? It's a form of counseling, but it's a supportive counseling. Not all counseling has to originate from a problem. It could be
Mm,
enrichment counseling, it could be supportive psychotherapy, it could just be mentorship. So there's different kinds of counseling. We just label all of it counseling, and that helps you move forward in life.
awesome.
Yeah.
Thank you. Thank you. So I know I interrupted your other. You were talking about other types of mental illness. So do you want to go on? You talked about depression, bipolar, and
Yes. So
yeah.
I sorry about that. Are you,
Go
are
ahead.
you okay? So there are different types. The major one, the most common ones are anxiety,
Mm,
that excessive worrying, intrusive thoughts, and when people are anxious, they sweat a lot, their palms are sweaty, they're cold, their heart is racing, they're sitting down, but their heart, they feel like they've been running. So that's anxiety, and there are different kinds of anxiety. There's depression, sadness, sleep. You go to sleep at 11, you're waking up at 3 in the morning, 4 in the morning. You feel no joy, no happiness. So that's another form of mental illness. And there's bipolar. A lot of people don't know much about bipolar because there's different types of bipolar. The mood up and happy today, down tomorrow, or they become excessive, reckless behaviors. We call that bipolar. That again, and the level of counseling. There is post-traumatic stress disorder, and that I think maybe the one of the most common ones, from neglect, abuse, either verbal abuse, sexual abuse, physical abuse, leaving somebody to be in a state of fight or flight all the time. And sometimes counseling and medication does the work for that. And the ones we all see in the streets are the schizophrenia. Those are the severe form of mental illness, schizophrenia, where their thoughts are disorganized, where they are, sometimes dressing awkwardly, being bathed in shower, all of that. And those are kind of the severe ones that require hospitalization. While I have given you a little bit of glimpse into each one of them, all of them are treatable. People
awesome.
can live a full life with medication and counseling.
I'm happy
Everything,
to hear this. So they are
everything.
treatable. So this is good news. That means if after some early recognition and detection, people should not hold back to say, they're going to condemn me to a psychiatric ward and my life is going to end, my career is going to end. So there is hope. There is treatment available. So on average, say somebody that is diagnosed of anxiety or bipolar, if they have to be put on medication, how long on average? I think probably knowing this might give hope to some people like, okay, it's not a death sentence. It's something that I just have to commit to and get over.
Okay, so before I answer that, I have to say that mental illness does not discriminate. It can happen to the richest of the richest. It
Mm,
does not discriminate against age, or whether you're a man or a woman, or your income, or social status, or race, or ethnicity, or religion, or spirituality, or your background, or cultural equity. It affects anyone and everyone. So, in saying that, when someone comes in for anxiety, for example, we will assess if that a person just needs counseling. And
mm,
we call that specific counseling for anxiety cognitive behavior therapy. It's almost like you find out what is the cause of that anxiety and help them deal with that. Not every one of them requires medication. It could be
good.
with them, it could be just guiding them, it could be just meeting them with weekly basis. Again, there is a place for just talk therapy. And if it's that bad that they can't even get out of their house, that's when we give anti anxiety medication. The length of any treatment really depends on the person. Are they feeling better? Then you gradually calm down on that medication until they're completely off medication and they can live a full life. If it's depression and it runs in the family, grandmother had it, mother had it, great grandmother had it, it's been there. I would rather see is somebody living a full life to the best ability they've been given if they need to be on medication. So the length of that medication depends on how that person is able to function in society. If they're mothers, how the best mother they can be, and as a human being, or best dad, or whatever their best is, are they living the full life? Are they functioning? Can they go to work? Can they function at home? Can they take care of their children? Can they bathe? Can they eat? Are they functioning as a full to their full potential? So it is the response of that person that determines the length of medication. Some people need to be on it for 6 months. Some people can be 1 year, but we don't want to see current relapses of the illness happen.
Okay. Thank you. So you said something that has always been a worry to me as a person of color when it comes to understanding history, medical history precisely, where you just hear, oh, grandpa has passed to glory. So grandpa has passed to glory. What happened to grandpa? Nobody knows. Nobody's saying nothing. And these informations, I believe they are good to be passed from parent to child, generation to generation, so that people can, look out for themselves in a very proactive way and not reactive way. Can you please speak to this? What can we do as a people to change this narrative of secrecy about our mental records and history?
Well, part of getting a full history is wanting to know you and wanting to know your own lineage. And so, because mental illness has such a strong stigma, especially in Africa, I think it is important to destigmatize. No different from somebody. If somebody has cancer, they're not going to go to the doctors and get a treatment for it. Diabetes, asthma, all of those things are on the same level. So stigmatizing mental illness is the first thing to do. And then when you hear somebody died at 40 years old, or they were locked up, or they just disappear, it's good to talk to the family to say, well, in order for me to protect my siblings and generations to come, what is it? What was it? Now, they may not have the words for it, they may not have the diagnosis for it, but it is good to know. And so when somebody is speaking to a healthcare provider, professional, to a doctor, to a social worker, to a counselor, saying, though we don't have a diagnosis, but we do know that an uncle on my mother's side or my father's side, we were told that the person just vamoosed or went away or was locked up, but we don't know. But it is good to start sharing. There's no shame in sharing. As a matter
Mm,
of fact, when you know more about yourself and you're equipped with knowledge, it is power, it's healing, and it's breaking that generation. Because when
mm,
a child knows growing up that their mother had depression, rather than wait for the depression to hit another generation, you share it and the person can get treatment earlier and they don't have to go down or hospitalized. You save your generation from being in the hospital. I guess the key here is when you treat any brain problems, the earlier the better.
mm,
Multiple relapses of mental illness is like fire on the brain. And you don't allow the neurons in the brains to fire well. They go further and further and further apart. It's like a damage to the brain all the time. So early treatment results into better outcome.
good, good. Thank you. Thank you. So we should seek information of what happened to our parents, our relatives, and just know what are the potential fires that we can quickly put out before they become a wildfire, right? I think that's very important. Okay,
Absolutely.
so I have another question. You talked about sweating, sleeplessness, maybe overeating. Are there other signs or symptoms that we can look out for in people or ourselves to be able to say, I think something is off. I need to take a further step or action?
Okay. So there are few ones. I mean, I think that if we look at, if you want to check yourself personally and you decide that check myself, there is a screening tool called a patient health questionnaire. You can click on it and answer those questions. And each question carries a score. For example, the first question might be, in the last 2 weeks, have you felt lost interest in play or pleasure doing the things you used to love? And the first question, the first score might be 0. The next one is yes, more than after days 1, or every single, it might be a score of 3. And you answer all those 9 questions and then you tally it up. When you tally it up, the lowest is maybe 1 to 4, means it's mild. Maybe you're just going through a financial difficulty or some level of difficulty, and you just need to talk to a friend or to a counselor. But 5 to 9 shows mild depression. 10 to 14 shows moderate. Oh boy, you need intervention. You need to speak to somebody. And then after 15 to 27 shows that you're moderately depressed. Now, that person may not know it, that that's what they're going through, but a best friend could be the one picking it up and say, let me talk to you. What's going on? And the person might say, I've not slept in days. I'm sad. I'm constantly crying. I can't eat. Or somebody with depression might would tell you all of that. I'm always shaking. If I want to go out of my house, I'm shaking. I can't get on the bus. I can't drive my car. You begin to say, maybe you should go speak to somebody professional. The bipolar one, however, is somebody that does things out of reckless behavior. They spend all the money in the family, they get the family in trouble, they take 100 miles an hour. That's when you begin to say, this person really needs. And families and friends are the best people that can get the help for the person. Anxiety and depression, the person can just go for help. But when we talk about the serious ones, family members see the behavior in the house, hasn't gotten out of bed, hasn't bath or a shower in 4 or 5 days, hasn't eaten, wears the same clothes, body odor. Oh my God. Then you begin to say, I think we got to get this person some help. So those are all the signs and symptoms. It's not internalized. You can see it. You can hear
So
it.
they are visible.
They say is visible, is negative, the country is going down, or this person is after me, this one is doing things to hurt me. You begin to see paranoid behavior. Somebody's after me. I can't get out of my house. They're watching me. My house has been bugged. My phone has been bugged. It begins to alert you that there's something more. Now, that could be just a personality disorder, and personality disorder stems from negative, dysfunctional environment, that nurture versus nature, or not, those kinds of things. And those are some of them will do well with therapy.
Thank you. So it's intriguing to find that your last explanation or example fit into mental health category, because I've been puzzled where you just see some people just behave very awkwardly and they are really not seeing it as anything wrong. So personality disorder is also a type of mental illness, right?
Yes, it is.
So where people that we know are suddenly behaving in an unusual or unreasonable pattern, and you just don't want to cross boundaries, how do you advise that we can communicate this across without coming as if we're attacking their personality?
So there are, I would divide mental illness into two groups. Mental
Okay.
illness disorders are brain problems. Personality disorders are the way people behave towards the society and to the world. And that can be a byproduct of mental illness. That could also be the environment they grew up in. That could be how they found mom and dad always fighting or siblings always arguing. We call it dysfunctional home, or they hear their parents talk about who is doing who is after who, they begin to fear for their own life because all they saw in that home environment. Remember, we parents model to our children. So when your child sees you as a strong dad or mom or a strong uncle, positive, they tend to develop that. But when a child grows up seeing a parent always constantly talking about somebody's after them, somebody's doing them, somebody wants evil for them, someone doesn't want them to prosper in life. And that's the environment they grow up in. What that does to that child is that it gives them a sense of insecurity. They also begin to believe that their best friend could want the worst for them. And so their personality comes out as paranoid, and it is good if they recognize that about themselves and they will want to be more positive. Counseling will do that. Cognitive behavior therapy, it's almost like a tape that's playing in the head. You're no good. People are after you. People don't want you to succeed. People will steal from you. Your phone is being bugged. People are after you. Going for therapy, and they would teach them how to challenge those thoughts. You can then say to yourself, okay, who is after me? But I slept yesterday. Nothing bad happened to me today. So, but it is a long term therapy. It's changing the mind. It's giving them something positive to hang on to. It's telling them from a spiritual point of view that you are created for good things in this life and no one needs to take it out of you. It's helping them recognize, yes, there is true, there's evil in this world, but they're not specifically after you. It's you learning how to challenge your own thoughts and say, is this correct? Is this rational? Is this irrational? So again, it is about that's therapy. Most personality disorders are driven, the treatment for those are therapy based, talk therapy, challenging the thoughts and bringing them back to reality.
Thank you. So, my next question is, as we go through life and we have different fluctuations of emotions and reality that hits us, what are natural things that we can do personally to kind of create a reset to our functionality? What are those things that we can do to help us be functional in a sane way, even though life happens?
Well, I think that that brings us to positive lifestyle changes to reset. Good question. How do we reset? We start by watching what we say, and that is truth, but we operate from a place of love. We also change the way we act, eating right, one from having a relapses of depression, you know, um, making sure that the food is well balanced. Also, a form of exercise, anything that makes the body move. When anxiety hits, anxiety just means fight or flight stage and the center of your body. Anytime you move your body, whether you love dancing, whether you like walking, anything that eases that, you take a nice deep breath in and out. Prayers are helpful, but prayers is helpful. Also, making sure that you have medical checkups. Because if the thyroid, one organ in the body on the around the neck is called the thyroid, if it's off, it will show up like anxiety. Making sure that you have regular medical checkups with your doctor, making sure that blood work is done, how going for yearly physical exams will do it. Being in a positive environment, if you're with your friends that are positive, that you support one another, that will reset things. You know, encouraging yourself will reset things. If you need to be on medication, taking the medication on a regular and consistent basis. Don't take it tomorrow, that will cause relapse. But resetting is a whole lifestyle changes. Meeting
Mm,
with a counselor, either in church or a professional counselor, will reset us and it will reduce the relapses and put people on a level plane.
mm,
Sleeping is a good hallmark for any mood disorders or mental health. We are all supposed to at least have 7 to 8 hours, sleeping 2 to 3 hours, getting up, running around, coming back, going to bed at 12, 1 in the morning, do it. The brain needs to rest. Remember, mental illness is like fire in the brain, so to speak. So when you rest, the brain rests. If you notice that the days you've slept very well and you wake up the next day, you're ready to go. You're full of life.
yeah.
Mood is not abrasive. You're not angry. You're not screaming. So sleep is very, very important.
Awesome. Awesome. Thank you. These are beautiful, not expensive, easy to achieve activities that we can do. So, people, I hope you've heard it from the best people that are practicing these things on daily basis. We have to be intentional about our health. We have to take it seriously because, like, here in the US, it's not a my car is not feeling good thing for you to go do inspection. When it is that time of the year, we go for it and we get the report. Oh, everything looks good. Oh, this one needs to be changed. So if we can do those things to ephemeral things, things that don't have life, so to speak, we should value ourselves more. I think that's the crux of this matter. Pay more attention to ourselves, do what is going to like benefit us more, be intentional about yourself. And I think this is doable. So wherever you are in the world, watching what you say, it costs you nothing but research, mindfulness, intentionality, acting right. You want to make sure you're eating good food. Don't just say, oh, because there's food here, I'm going to eat myself out and be out of shape and everything. Exercise, walking, she said dancing. And good, we're Africans, we love to dance, we go to parties. So just do these things that are not as expensive as it seems to achieve. And I believe we'll be in a place of a balanced mental wellness. And with prayers and a good support system, I've really learned I believe we would do well with ourselves. And like he said in the fire, this is the first of many sessions to come. We care about ourselves, we love ourselves. So we are so happy that we've kicked it off today to bring this awareness to us. Life is beautiful, life is worth living, but we have responsibility. Like our life is like a garden, we need to nurture it, we need to weed it, we need to water it so that it can grow and thrive. So I need not say much. You've said a lot today, Dr. Tai, and I really hope our audience have taken notes and are going to take advantage of some of this information that you shared, like the PHQ-9. It's a very, very interesting questionnaire. I saw it myself online, and I think it's something we should do. Don't wait for a disaster before you take action. Let's be proactive and not reactive. Thank you so much. I really enjoyed my time discussing this subject with you, Dr. Tai. Is there a parting word you want to say to our people in Africa, even those that are in the US? Because I know we have some audience like globally. So, as people of color and even not colored people, whatever, what is your parting gift?
Well, thank you so much, Oluwatoyin. I really appreciate your time in bringing an awareness. As I've said, mental illness has no regard for a man or a woman, young or old, colors, ethnicity, whether you're spiritual or not. It is a problem of the brain. And it is important that we embrace one another, seek help where we need. And alcohol is not a medication, because I know that Some people will drown out their depression with the use of alcohol. So
Mm,
I want to bring that awareness that it is good to talk about these things. When we begin to talk about it, we destigmatize it and we help people become the best they can be. I have doctors as patients, I have engineers as patients, I have lawyers as patients, janitors, stay home moms, and all we can do is live learning, living life to the fullest is seeking the help.
awesome, awesome. Thank you. Mental health is no discrimination. Your career, your race, your height, your bank account doesn't matter. You heard it all. So people, this is information for you, not just to watch and get off and continue what you've been doing before if it's not the right thing. Take action, be accountable for yourself, and start living a purpose driven life. I wish you well, I wish you health, and I wish you wholesomeness. Thank you for joining us today, and God bless you all. Thank you again, Dr. Tai.
You're very welcome. Thank you, everyone.
Bye.